I'm attorney Andrea Witt, joined by
attorney Stephen Spano. Today we're tackling one of the most important and confusing decisions Medicare beneficiaries face, and that's choosing between Medigap and Medicare Advantage. These are two very different approaches to covering your healthcare costs, and the choices you make can affect your finances and your access to care for years to come.
Let's start with the basics. Original Medicare, Parts A and B, cover 80% of your approved medical costs. That leaves you responsible for the remaining 20%, plus deductibles and other out-of-pocket expenses. Without additional coverage, a serious illness could cost you tens of thousands of dollars.
And you have two main options to fill that gap. One is Medigap, also called Medicare Supplemental Insurance. It works alongside Original Medicare. The other is Medicare Advantage, also known as Part C. It completely replaces Original Medicare with a private insurance plan. They solve the same problem in completely different ways.
With Medigap, you keep Original Medicare and add a supplemental policy that pays most or all of what Medicare doesn't cover. You can see any doctor or go to any hospital in the country that accepts Medicare. There are no networks, no referrals, no prior authorizations. You receive care where you want, and the bills get paid.
Medigap plans are standardized and labeled with letters such as Plan G, Plan N, and so on. A Plan G plan from one company covers exactly the same benefits as a Plan G plan from another company. The only differences are the premiums and the company's customer service. This was designed to make comparison shopping more straightforward.
The trade-off with Medigap is cost. You'll pay a monthly premium for your Medigap policy on top of your Part B premium. And Medigap doesn't cover prescription drugs, so you'll also need a separate Part D drug plan. However, your out-of-pocket costs when you need care are minimal and predictable.
Medicare Advantage takes an entirely different approach. These are private insurance plans that contract with Medicare to provide all of your Part A and Part B benefits. Most also cover your Part D benefits. Many plans advertise $0 premiums, and they include extras like dental, vision, and hearing, in addition to the prescription drug coverage, all in just one package.
That sounds attractive, but here's the catch. Medicare Advantage plans use networks. You may need to choose doctors from the plan's network, get referrals to see specialists, and obtain prior authorization before certain procedures. If you see an out-of-network provider, you might pay much more, or the plan might not cover it at all.
Medicare Advantage plans have annual out-of-pocket maximums, which Original Care does not. Once you hit that limit, the plan pays 100% of covered services for the rest of the year. The ceiling can provide protection against catastrophic costs, but you could still pay several $1,000s before you reach it.
Here's something critical to understand. When you choose Medicare Advantage, you're not using Original Medicare anymore. The private insurance company controls what's covered, which providers you can see, and whether treatments require approval. Your experience depends entirely on that company's policies and network.
And so who should consider Medigap? Well, generally people who want maximum flexibility in choosing their doctors and hospitals. In addition, those who travel frequently or split their time between states, and people with chronic medical conditions requiring specialized care, as well as anyone who values predictable costs and minimal paperwork when receiving care.
Medicare Advantage may work well for people who are generally healthy, comfortable with managed care networks, want to minimize monthly premiums, and primarily receive care close to home within the plan's service area. The bundled benefits simplify things if you want everything in one plan.
A crucial warning: switching back from Medicare Advantage to Medigap coverage can be difficult. Be sure to watch our prior segment if you want to know how to switch back from a Medicare Advantage plan to a Medigap policy in Massachusetts.
Don't let flashy advertisements make this decision for you. Understand what you're giving up and what you're getting with each option. Consider your health, your doctors, your travel habits, and your comfort with the private insurance company's oversight of your medical care in Medicare Advantage plans.
This is one of the most important healthcare decisions you'll make. Take the time to understand both options fully and consider speaking with a board-certified elder law attorney who can help you evaluate what's truly best for your situation, not just what looks good in a commercial.
Join us next time when we'll present more knowledge and tools to help protect your health, your assets, your income, and your independence.
Questions or suggestions, contact Spano, Dewicki & Witt at 781-231-7800 or at help@spanodewickiwitt.com.